Mr. Shanmugam, are you there? Connected account.
Hello? Yeah. Now.
Mr. Shanmugam, are you there?
Yes, sir.
No, I just want to know when I have to share the screen, I can switch it on directly or should I give it to you first?
Sir, I didn't get. Come again?
I got some PowerPoint presentation.
Okay.
I can put it on share screen straight away?
Yeah.
Okay.
Hello, Mr. Shanmugam, can you hear me now? Hello? 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 Hello?
I'm not getting audio from your side.
Sir, we are going live, sir. We'll switch on your video and audio in some time. Please hold, sir.
Thank you.
SRM Institute of Science and Technology, Engineering, Medical and Health Sciences, Management, Dental, Science and Humanities, Law, Agriculture Sciences, Hotel Management. Admissions open. SRM Institute of Science and Technology, Engineering, Medical and Health Sciences, Management, Dental, Science and Humanities, Law, Agriculture Sciences, Hotel Management. Admissions open.
Good evening, everyone. Can we start?
Yes, ma'am, please.
Good evening, everyone. Welcome to this webinar on current and emerging career opportunities in nursing and paramedical courses. We have with us three speakers, three panelists. Professor Lieutenant Colonel Ravi Kumar Arunachalam. He is the Pro Vice Chancellor, Medical and Health Sciences, SRM Institute of Science and Technology. He is a member of the National Academy of Medical Sciences, Fellow of National Academy of Medical Sciences, and Fellow of Royal College of Physicians and Surgeons of Glasgow. His current focus is on cochlear implantation, laryngotracheal stenosis, noise protection devices, medical education, hearing awareness camps in districts of Tamil Nadu for children with hearing impairment. Welcome, Dr. Ravi Kumar.
Thank you.
Professor Roy K. George. He is currently the Director of Academics, Baby Memorial Hospital, and Principal of College of Nursing, Kozhikode, Kerala. He is the National President of Trained Nurses Association of India and member of Indian Nursing Council. He has held the position of Regional Director, School of Medical Education, Mahatma Gandhi University, Kerala. Dr. George has authored 2 books and is currently partnering in a multi-centered study on mild cognitive impairment in collaboration with Albert Einstein College of Medicine, New York. Welcome, Dr. George.
Thank you.
Dr. B. Rajshekar is the founder and former Dean of Manipal College of Health Professionals. He is an alumnus of the All India Institute of Speech and Hearing, Mysore. He is the recipient of several international fellowships and awards, including from the UK, the USA, Australia, Canada, Sri Lanka, and South Korea. Dr. Rajshekar is the first Indian to be conferred the Outstanding Contribution Award in the field of speech and hearing in the Asia Pacific region in Guangzhou, China. He is a member of the Expert Committee of National Hearing Impaired of Rehabilitation Council of India, the RCI, the statutory body under the Ministry of Social Justice and Welfare, Government of India, and RCI Inspector and member of the Core Committee constituted by the Union Ministry of Health for the proposed National Council for Allied Health Professionals. Welcome, Dr. Rajshekar. All of us must be waiting to hear from all the panelists, so I'll leave the floor open. It will start with Dr. Ravi Kumar.
Thank you, Ms. Sujata. Good afternoon to my co-panelists and the team at Hindu, and a very good afternoon to all the participants in this webinar. I welcome you on behalf of SRM Institute of Science and Technology, the Medical Health Sciences Group, of which I am the Pro Vice Chancellor. I take it an honor to be talking to you today and trying to explain some of the nuances of what is allied health sciences and what it constitutes and what it has got for especially students who are aspiring to become healthcare professionals. In olden days, whenever we talked about healthcare, it was always referred to as a doctor-oriented profession. It continues to be so, but to a large extent, people have understood the importance of other specialties in the healthcare scenario, which are also integrated into the profession of health education, as well as in treatment of patients. So a modern hospital does not contain only doctors and nurses. It also has other healthcare workers, of which we will talk in more detail today. And I am proud to be associated with the University Hospital in SRM, which is containing not only the hospital having all these various components of healthcare, and also it's got the potential to train and hone the skills of many aspiring healthcare professionals. So briefly speaking, I'll highlight the importance of allied health sciences in this limited time I have to talk. And if you see this slide which I put up now, you find that there is a lot of emerging opportunities in the field of nursing and paramedical fields. And this has happened over the last 3 or 3.5 decades, because it has been found that it is not just enough having a doctor to cater to your needs. It's also important that he is assisted by a team of people, because as medicine advanced, the complexity of the procedures which we perform also increased. Automation, instrumentation, and equipment which are specially designed for certain treatment came in. We required a lot of other people to come in to help restore, not only make the patient free of disease, but also make sure that the patient goes back as a fit person into the society. And we learned this more during this pandemic, especially during COVID times. We found that living was difficult initially, but because of innovating and working together in our own specific context in this particular period, as a health worker team, we were able to perform better. And we learned from each other. We experienced the problems and solved the problems together, developed new skills. We trained a lot of people who were not knowing much about COVID. And we were able to demonstrate a certain degree of competence in managing the situation. So what do we have for you today? These are the list of courses we are having in our the Medical and Health Sciences group of SRM has got 7 colleges under its wing. The medical college, being the oldest, started in 2005, under which, in addition to the MBBS, MD, MS, DM, MCH degrees which are awarded after training, we also have a 1,210 bedded hospital, multi-speciality with all the specialties you can think of, with equally competent faculty members. So in the same college, we also run courses for allied health sciences, which are mentioned here. If you see, there are about 11 courses which have been going on for the last 4 or 5 years. And the ones in the orange color are the ones we have started this year. Suffice it to say that each one has got is leading towards a particular major specialty in medicine. For example, audiology, speech language pathology will be associated with ENT, ear, nose, and throat. I want you to picture a child who unfortunately is, if you use the term, born deaf, or severely hearing impaired, that even the most powerful hearing aid cannot restore the hearing or they not make the child hear. Now with technology, we are able to restore or at least bring back the hearing by performing a cochlear implant, a device which is put in the inner ear by the surgeon. But the problem doesn't get solved there. So that child needs more intensive therapy, which is provided by the audiologist. And the child is taught to speak and learn language by the speech language pathologist or the audio verbal therapist, who all are specialized in their own fields. And this collective team restores the function of that hearing as well as speech and language development. So like that, optometry for ophthalmology, correcting visions, clinical nutrition, where we need to give special types of diet for people. We need nutritionists. We have a lot of cases, a lot of patients undergoing cardiac surgery. For them, we need specialists to maintain their blood flow during the surgery. They're called perfusion technologists. Critical care technologists who are present in the ICU, and so on and so forth. And recently, we found that a lot of people having mental illnesses, especially during COVID time. So we have started a course called clinical psychology for counseling people with problems, including students aspiring to enter a higher education institute. So in Indian school system, you find that most of us around the age, when they are in 9th, 10th standard, they have to make a decision which branch to take. So most of the people who take biology as one of the branches, along with chemistry and mathematics, now they come into the biological stream. So there, the initial thrust or the aim is to crack the NEET exam and get into a medical college or a dental college. It doesn't happen. Everybody cannot come into that field. For them, the next alternative, where they can still keep their focus on biology and trying to do something related with healthcare, these are the courses to look for. So we also have master's degree in these specialties according to the interest of the person. And those who would like to have a shorter course, there is a diploma in the same field, but the core subjects are taught here. Further specialization and compulsory internship is not covered in the diploma, which is internship is where the student actually works in the hospital along with patients under supervision and learns how to manage patients in that scenario. We move on to pharmacy, where again, we have a course in Bachelor of Pharmacy. Now, you know that in the COVID era, especially now, we have a lot of emphasis on therapy meaning treatment of this virus. Since there is no proper drug available, we are trying out many drugs which are antiviral or certain antibiotics which are also effective in a viral situation. Or we can go to other therapies, including vaccine which is being developed. All this work of developing the vaccine or the medical and medical medicines, drugs is done by the pharmacy industry. The huge industry. In India, you'll be proud to know, is the one which exports the maximum amount of pharmaceutical products in the world. Pharmacy is very well developed. So there is a lot of scope in this field. And it's a 4-year course. And there is a separate course called PharmD, where it's a 6-year course. And each one has got its own advantages, and we can actually get a better satisfaction in performing a job which contributes to the health industry. And the job opportunities are many. You could join a clinical job or an R&D scientist. You can be a drug inspector, you can be a sales and marketing executive, etc., etc. These are all well known, and I don't want to delve into details here. Suffice it to say that there is a lot of scope for employment after doing these pharmacy courses. Move on to nursing, which is well known. You all remember Florence Nightingale and how she became the lady with the lamp, and she's still being followed because it's a service-oriented profession. And nursing is a noble profession, and we have a lot of shortage of nurses even today. But what is interesting is the number of sub-specializations which have happened in nursing. We have the BSc course, which is a 4-year course, including 1-year internship. And then we have MSc in various subspecialties of nursing, including psychiatric nursing, pediatric nursing, which is children's care. And recently we started these courses, which are also important for nurses who are already working, that is critical care. ICU nursing is a different ballgame. You need a little more training. Disaster management is again quite a difficult subject. So we have extra 1-year training there. Operating room where the nurses assist the doctor for performing surgeries, again needs a lot of training. So to strengthen the training, we have introduced these courses in our university. Most of the courses, the eligibility for a bachelor's program is going to be your class 12 pass and with good marks. Further details you will find in the website of SRM. A specialty which is not well known is occupational therapy. Now, when somebody who is either born with a problem, orthopedic problem, for example, a hand which is deformed or a leg which is not properly shaped, he can't walk properly, or he has some handicap. So that person, if he undergoes a surgery to correct it, after that, to restore him back, not only to use that particular part of the body, but also perform a job which is suitable for him, is very important. It's not enough just curing the disease. It's something is inborn deformity, but you are able to make it better, but you cannot make it function well unless you have an occupational therapist. And that duty is done taught by this particular course, which is called Bachelor of Occupational Therapy, BOT, Masters of Occupational Therapy. So we have the specialization in neurosciences, orthopedics, pediatrics, mental health, etc. So it's overall very satisfying to see a person who is born with a problem. For example, you see there are people who cannot write well. They're taught handwriting, how to balance themselves properly and work without shaking their hands and body. Sensory integration training, neuro rehabilitation, balance training, motor training. Motor meaning that is you are able to move. This person has had a surgery in his spine and he is being taught how to walk properly, and after that he'll start performing his job. He must have lost it in an accident. Similarly, so many specialties are there. Very satisfying job to do, because you see the same person who was unable to do a simple maneuver can actually become much more proficient. Physiotherapy, on the other hand, is restoring the function after a temporary loss of function. It could be due to an accident, a fracture, broken bone, but since the joint has to be working normally in order to make the person function normally, we do physiotherapy post-operative. Similarly, you can have for lung diseases, after delivery, etc. So many branches there, and the recent one is the sports physiotherapy. You all know sports medicine is a very important, become a very famous specialty now, especially with sports taking a center stage in our country, thanks to the television coverage, etc. So sports medicine is another nice specialty to come, speech therapy. So our some of our students who have gone through this training have given us this feedback that they're very happy doing the training here because we have the infrastructure. We first train them in simulation labs, which are actually containing models or mannequins, which can actually simulate a real human being. And in that we train them. And then we train them in certain special workshop-like situations, and then bring them on to real patients in the hospital. So this training is well planned, and we use all sorts of methodology for training them well, and we give them a self-instruction modules, engage them in self-directed learning and hands-on training. Not only study all the time, there is also a lot of other social activities which go on in the university, and we are part of the Environmental Day celebration, physio team, international yoga, etc. Good placements are there for physiotherapists, occupational therapists, because they get a lot of opportunities to work in certain rehabilitation units. Some of them have their own private practice. Government hospitals also lack there's a lot of vacancies there. And some come back to us as a teaching faculty. This is some of the examples of what we have, biomechanics lab, etc. The last one in our medical health sciences is School of Public Health. All this so far, what I mentioned, is all related to the hospital environment where you have a problem person who will come as a patient. Whereas here, this particular health worker is going into the community. They're going into the periphery and actually engaging in what we call epidemiological work and trying to improve the health of the patient or of the persons there by giving them advice and guiding them about healthy practices. All of you have heard about the Swachh Bharat movement in India, how the government is trying to clean up all the villages and give them proper toilet facilities, clean drinking water. Similarly, in your home, if you have clean practices, many diseases can be prevented. So the public health part of this healthcare specialty involves this health management, how to prevent infections. Epidemiology is a science where you actually find out the reason why the disease occurred. For example, all of us know malaria is caused by the mosquito, but what measures are being taken to prevent the mosquito from breeding? There may be small interventions, but it will really be very useful if we educate the mass public, and they have a huge role to play in the overall healthcare system. So my dear students and parents and friends, this introductory talk was just to highlight the importance of allied health sciences in a holistic healthcare system where we take care of not only the sick, we prevent illness, we go in the community and work together, and at the same time, we bring back function and make the person fit for his occupation by intervening at various levels. It is not possible for the doctor alone to do that, or the nurse alone to do that. So we need a team. And this team is made of the Allied Health Sciences Group, who are all grouped under healthcare workers. Thank you very much, and wish you make a good choice, and SRM is ready to assist you in this. Bye-bye.
Thank you, Dr. Ravi Kumar. May I ask Dr. George to explain what exactly nursing is and how it actually goes along with the doctor's profession, but it still is very different. Especially in the case of COVID, I think more people would have been closer to the nurses than to the doctors. No ill feeling meant there, but please explain to the students what exactly nursing requires of the students and how it's as good as being a doctor. Dr. George?
Yeah.
Did you hear me?
Yes, yeah.
Okay. Could you please start your presentation?
Good afternoon. Thank you for that introduction. As Dr. Madrasa has told, the health science is a teamwork, where in addition to doctors, nurses, and other allied health professionals to play a key role. As the medical service or health service are getting more and more specialized and high-tech, involvement of different team workers in specialized in each area is very, very important. Right now I'm talking from Calicut, Kerala, or Kozhikode, and I'm very happy to be here in this seminar where we just focus on people who are likely to join the allied health field, including nursing. So the topic is nursing as a career, and basically I'm a nurse. This doctor just indicates a PhD, and I'm teaching in a nursing college. And this is a special year to talk about nursing because this is International Year of the Nurse and Midwife as declared by World Health Organization. Because World Health Organization felt that in the health professions, nursing, though a very large profession, is not getting the investment and recognition it deserves. And when the celebrations were about to begin or just begun, the COVID-19 came, and the picture all changed. But this occasion also focused, or it helped to highlight the service of nurses in the health sector, because in a COVID patient, more than medical care or drugs, the amount of care they get, direct critical care they get, is very important, where nursing has become very life-saving, and the whole world is praising nurses. And nursing is getting the recognition which has never got in the last 20 years. Actually, 2020 was declared as Nurses Year because this is the 150th anniversary of Florence Nightingale, the founder of modern nursing. I'm not going into that detail, but we had to come to the prospective aspirants of the courses. So when you take nursing as a career, what is the special features of nursing? It is the largest group of health professionals. We make more than 50% of the healthcare workforce. For every doctor, there has to be at least 4 or 5 nurses in a hospital. So that is the number of people. Next is growth opportunities are immense because it is all pervasive. It covers all the areas of health and medical care, from surgery to medicine or from gynec to pediatrics. So there are a lot of growth opportunities. And there are specialties like medicine. They have specialties and subspecialties in each area. Initially, it was like medical or surgical or orthopedic. Now, because every small specialty, there are trained specialized nurses. And it is a familiar profession in a global scene. Nursing is there, the modern nursing is there almost for more than 120 years. And there is an ever increasing demand because life expectancy is going up. When India got independent, our life expectancy was around 31. Now it is 65. So the number of people who need nursing care or medical care are increasing. So the number of, right now there is a good shortage of nurses. Even in India, if you take population-wise, there is a big shortage. Only because our health facilities are yet to be developed to match with the number of population that our nurses are able to go abroad, because there are shortage of vacancies if you generally take. Otherwise, we have a huge demand even in India. Outside it is, we are coming to that later, there is a large demand. And variety of opportunities. Opportunities of nurses, like many other professions, are not just limited to the direct nursing care. There are huge varieties of opportunities and developing. And there is big opportunity for vertical growth, from a staff nurse or the basic bedside nurse to the chief executive officer, CEO of the hospital or general manager. The growth opportunities are immense because a nurse knows in and outside of every area of hospital after their education. And what are the basic courses in nursing? Already Arnachalam sir has mentioned, but BSc in nursing, it's a bachelor degree of 4-year duration. That is the basic, now considered as the basic degree in nursing. But in India, we had diploma in general nursing and midwifery, 3-year diploma course. Both courses, the qualification is higher secondary or +2, 10 +2 education with biology, physics, and chemistry. But GNM is only for 3-year course, whereas BSc is a GNM degree. The diploma is awarded by the nursing councils or state boards of examination, whereas degrees are awarded by universities or deemed universities. But the Indian Nursing Council has recently taken a decision to take last batch of diploma in general nursing in this year, 2020. From 2021, we will have only BSc nursing as basic education in nursing in India, like many other countries. Most of the countries in the world have shifted to a degree level education. And in this connection, I have to just mention that post-basic BSc nursing. It's a 2-year course after GNM. If somebody has studied general nursing and midwifery course, they can do a post-basic BSc nursing. That means they can do a 2-year course, which is equal to BSc in nursing. That is where many of the nurses who are completed GNM are doing post-basic BSc nursing now, and that will continue for some more years, even if the GNM is stopped. But this year there is a GNM admission also. And higher education in nursing. To be brief, like any other bachelor degree, UG course, undergraduate course, there is MSc nursing in 5 major specialties. Specialties already Dr. Umar has discussed here. This is medical, surgical, maternity or gynec, child health or pediatric, psychiatric, and public health or community health. Of course, we have doctorates in nursing. That's why I have a DR with my name. It is a PhD in nursing. Then specialty diploma courses, 1-year diploma courses are there. Almost 20 specialties are available in India now. Like from psychiatric nursing to forensic nursing, everywhere there's 1-year diploma. Then this is one course, nurse practitioner course, just Dr. Arunachala mentioned. That's a new course just started 2 years ago. These nurses are allowed to practice independently. They have a permission to practice, but not like developed countries like United States or UK or Canada where they have independent practice. Here, this is not independent practice. This is practice within the institution setting where they are allowed to manage the patient, including prescription of a list of recognized drugs. Then we have postdoctoral fellowships also, PDF, which is started in many parts of the world. And what about which are the types of nursing education institutes? Dr. Umar Anajala has already told about SRM University and as a deemed university, what courses they have in nursing and allied health. But just to have an overview, that means it's central and national institutes. Earlier, we had an All India Institute of Medical Science and few institutes like JIPMER Pondicherry and PGH Chandigarh, but now we have already 13 functional All India Institute of Medical Sciences. Then the institutions owned by Government of India like JIPMER Pondicherry or Postgraduate Institute, Chandigarh and many other institutes of similar stature. Then there are state government institutions, state government nursing colleges in every state. There are number varies. In some states there are more than 10 or 12. Some states there are only 1 or 2, but there are in every state. Then pioneer institutions in private sector. Like BSc nursing course in India started in 2 institutions. One was the Government College of Nursing Delhi, which is later named as Rajkumari Amrit Kaur College of Nursing Delhi, which is in the name of our first Health Minister of India. And at the same time, we had a CMC Vellore, which started BSc nursing along with this Government College of Nursing Delhi. From their time, we have premier institutions like CMC Vellore, CMC Ludhiana, then many other institutes came. Then we had military nursing institutions. Military nursing, they have under the military service, they have separate military nursing service MNS, and they take the students, and all of them are directly employed in the military, in the captain rank, and which offers a very good opportunity. Of course, military takes short commission nurse also, but their job selection is based on military nursing and stipendary education, full free, and immediately on passing out their portion as commissioned officers with good rank and pay. Then we have deemed universities, which has come in the last 20-30 years, like few veterans in deemed universities are here, or Dr. Umar from SRM and Dr. Jayasaya from Manipal, and such many deemed universities are conducted. Then we have this new generation self-financing colleges, or so many private colleges. Why? Because there are pioneer institutions which are there for more than 50 years. That's why I put new colleges which are started from 1990 onwards. There are many in Tamil Nadu, many in Karnataka, in Kerala, Andhra. Most of southern states, there are plenty of colleges. As of now, we have about 1,500 nursing colleges in India offering BSc nursing degree. Of this, 1,250 are private colleges. The first only constitutes the government or deemed universities. And fees and costs. Fees and expenses vary from institute to institute. But government, of course, as you know, an All India Institute charges rupees 6,000 as annual fee. Whereas an private college average charge from 50,000 to 1 lakh on an average as fee only. But there are colleges which are charging more, but the average range is from 50,000 to minimum 50,000 to 1 lakh. Of course, military and some government institution, military is completely free. And then government sector also there is some difference, as low as 6,000 to, like in Kerala, they are charging about 30,000 per year for BSc nursing. And educational loan and scholarships are a main source of payment of fees for nursing students, because there are a large number of students. We have about 2 lakh students in India. And many people from lower socioeconomic status or lower financial status make it loan. And usually banks are very happy to provide education loan because it is a sure job sector, and because the majority female candidates repayment history is really good. Of course, with in the last 20 years, Government of India and state governments are providing so many scholarships for students, minority women scholarships, single women scholarships, and so many other national merit scholarships, and so many students are able to avail this. If you take times when I was a student, scholarships are very scarce to come, whereas now in every college they get at least 50% of students get scholarship in many colleges. And selecting an institution, there are so many institutions, and selecting an institution is a student's choice basically. But one thing which they have to always look into is the reputation of the institution. How reputed, how well known the institution is. That makes a big difference when you go for a complete course. Then next is facilities. The faculty who are the facilitators of learning, how experienced and reputed the faculty is. Then the clinical facilities. In nursing, a course like nursing cannot be done in a vacuum without a full-fledged hospital. And like those hospitals which provide care in the international standards is truly needed to learn nursing well, because nurses are supposed to take care of patients anywhere in the world, and once they pass out, they move around the globe. So they should have a very good hospital to get trained. And the students also have to check the recognition status of the council, the National Council or Indian Nursing Council, which is usually called as Indian Nursing Council. Then State Nursing Council recognition also is required. In Tamil Nadu, it is Tamil Nadu Nursing Council. In Kerala, it is Kerala Nurse and Midwives Council. In Karnataka, it is Karnataka Nursing Council. Each state has a statutory body. And then university. Of course, if it's a deemed university, the deemed university will be awarding degree, but otherwise the university recognition or university affiliation also is a must. And the student has to ensure that the institution has this recognition from university also, so that their degree will be valid once they complete their course. And a short look at the job opportunities in India. The basic post is in nursing service. Earlier we had the post called staff nurse, but 2 years back the central government has changed their post into nursing officer, the basic post. And in nursing service, when you start with nursing officer, you can be chief. You can gradually go up to chief nursing officer or director of nursing. In government institutions, usually it is chief nursing officer, whereas in private institutions, either director of nursing or chief nursing officer or such a post, so general manager of nursing or vice president nursing post like that. Then nursing education, like any other college or professional college, they have posts from lecturer to professor or principal or dean. Then public health nurses, where they work in community with the aim of prevention of disease and promotion of health, where we have a lot of posts. And next thing is middle level health providers, MLHP. It is coming in a large extent. The central government's aim is to provide every sub-center in the community, that is 150,000 centers across country, with a DSA nurse who is to be posted as middle level health provider. That is actually a post between the community health worker, the ANM or the health worker, junior health worker in the field, and the specialized doctor. They will be empowered to or authorized to prescribe certain medicines and first aid and emergency care. And because every small village will have a sub-center where there's a BSNS will be posted. It started in many states. It is going to be there. That creates a big job opportunity in the health sector. Then hospital administration, starting with the assistant administrator or hospital administrator, they grow up to become the general manager or the vice president or CEO or chief operating officer. The hospital where I work, the CEO is a nurse. Many of the Apollo Group hospitals, they have CEOs as nurses. So in many corporate sectors, they are coming in the administration. Then quality assurance and audit. These days are, we are on quality assurance of hospital care or health care, and quality assurance area where there are quality officers, and doctors or nurses are the best people to be quality officers because they know every aspect of the healthcare to a certain extent. So nurses are largely being put as quality officers. Then medical insurance assessors. As medical insurance sector is doing, a lot of nurses are appointed by insurance companies to judge the medical bill before paying the insurance, whether it is genuine, because they know in and out of the treatment, and so there is medical insurance assessors. Then nurse entrepreneurs are coming in large. They are starting simulation labs or nurses continuing nursing education training or providing nursing at home care of nurses for those people who are debilitated or bedridden. They provide agency-based care. So many nurse entrepreneurs are developing, especially in big cities like Bombay, Delhi, Madras, or Chennai, and Calcutta. Then nurse journals and editors with a lot of publications. There are appointments as in health sector as well as for general public. They appoint nurses as journalists, assistants, or editors, or editing the books or the journals. Then nurse researchers, it's coming in a large way with a lot of clinical research and patient satisfaction research going on. Nurses are appointed as clinical researchers or nurse auditors. And opportunities abroad. Of course, clinical nursing positions similar to that of India and much more broader and much more specialists are available across the globe, especially in the developed countries like USA, UK, United Kingdom or England, and Canada, Ireland, Australia, New Zealand. These are the main areas where our nurses migrate. And for example, in England, as of now, as of 2020, by 2021, they will have 45,000 vacancies of nurses. And when the government of UK has made an arrangement with my association, Trained Nurse Association of India, to recruit as many nurses as possible, and all recruitment expenses are paid by government. The nurse hospital doesn't have to pay a penny to go. They have the quality test. There is about skill test, knowledge test, and also English test. And they are finding it difficult to get enough nurses. And so many nurses are in a very bad shape because so many nurses already recruited cannot go because of COVID and flight cancellation. They are eagerly waiting. Same situation is going to come in US also because large number of vacancies are already there. The policy change is there. So anyway, there are a lot of nurse practitioners. I just mentioned about Indian opportunities. Most of the nurses who have migrated from India are working as practitioners in many places in UK, USA, and because it is highly paid, they have more social status and they have the scope of practice is more. And then nurse specialists in its specialty, nurse teaching. Nurse educators from our countries working many places in the Middle East, in the Gulf countries, as well as in the Western countries. Of course, researchers I mentioned. And if you once the student go out of India, the scope for higher education much more wider because the facilities, the specialties they get and the training they get is much more wide. And then now there is newer trends. Because the number of nurses have gone up, number of nursing institutions and nurses have started diversifying into other fields like psychology. They go for clinical psychology or become they take MBA in hospital management from Economics Institute or health policy management, public health policy. Then many of the nurses have, of course, taken BSc nursing as a basic degree and gone to civil services and other sectors like banking, Karnataka administrative service and things like that. That's also is happening. Like once you do BSc nursing, you find that this is not your area. Of course, this is considered as a degree now because there are a lot of people there. So people who would like that also. And I stopped here, but just to conclude, because it started with Dr. Umar throwing a light. I was asked to just focus on nursing, and I think I've given enough information on how nursing is as a career and what are the opportunities and what are the education practices. Of course, we can have the question answer session. And thank you for patiently listening and this opportunity.
Thank you, Dr. George. Now we come to an important segment of this seminar. It is Dr. Bellur Rajshekar. He's going to speak about the various other kinds of courses that students can pursue. So here I want to say UG is undergraduation, that is to the level of bachelor's degree. PG is post-graduation, which is done after the UG. Some students had asked this question, so I'm just clarifying. Dr. Rajshekar, please carry on from here. Yes. Yes, you are audible.
Very good afternoon to everybody. I think you had an excellent overview from the Pro Vice Chancellor, Dr. Ravi Kumar. He gave you a full perspective of the medical spectrum, which also included the allied health sciences. He spoke about nursing, he spoke about pharmacy. Okay, but now the focus is going to be more on the allied health sciences or the allied health professions, for the reason that people have known over the years about what's medicine, what's nursing, what's pharmacy. This is a new era or a new area which I think was unfathomed. The concept of the allied health sciences itself is a new concept in the healthcare. In the Indian context, though it's very well known in the West, in the US and UK and Australia, it's very well established. It was way back in 1999 that in the Manipal Academy of Higher Education in the West Coast, right, that a first full-fledged College of Allied Health Sciences was created or carved out of the medical school to give it a focus and also to give it a leverage of developing on its own. We began with a very meager 6 programs and about 150 students. And now over the last 20 years now, we have scaled it up to 2,500 students in 3 campuses. We have 69 to 70 allied health sciences programs. And we have faculty strength of about 160, of whom more than 60% have the highest academic degree of a PhD. And the support or the attachment to a medical school or a medical college and a hospital, are something which has really given a fillip to these allied health professionals. So I'm going to just give you an overview of how this developed. What is the concept? What's the myth? And what's the reality about allied health professionals? And how is it different from medicine, or how the interdisciplinary approach or the team approach is the way of the healthcare globally also? And what are the programs being offered out of the SRM that you can think about? And what are the future prospects? So as I told you about, the myth is that, if you talked about 40 years back, you had, when you say paramedic, had a very low connotation because it was basically somebody who was working with a doctor, in his clinic. Like, you have a doctor, a general practitioner who trains somebody, to mix the powder and then the syrup and give it, who was called as a compounder, right? And later on, the compounders, became qualified. They knew more about the field. And now you have no compounders, you have only pharmacists. The same way, certain people who were with the physicians or the surgeons, helping them out with the various nuances of the medical treatment. Okay, they were called the paramedics. Okay, they were at a very low level. In fact, there was no regulated training. They didn't have much knowledge about the theory part of it. They didn't know much about anatomy, physiology, the biochemical aspects of a disease. So they were just, kind of acting on prescription from a doctor. But now the term paramedic is obsolete in the West now. Now they have moved over to what's called the allied health professionals. And recently at Manipal, now we have renamed it as a health professionals. We call it as Manipal College of Health Professionals, no longer allied health, which means we are now coming up now. We have people with more caliber, with more knowledge, with more, credentials, like what Dr. Roy was saying about nursing. A basic nurse, do you have now nurses, under different specialties, different categories, under different, qualifications, who are instructors, who are professors, who are researchers. So there is a wide array of opportunities in the allied health. So the myth of a paramedic, is something who is being very substandard or, being inferior. That has to be dispelled first from your minds. Now, if you look at 40, 50 years back, if you ask any parent, what do you want your son or daughter to be? They would say, I want him to be a doctor. I want him to be an engineer. I want him to be a chartered accountant. I wanted him to be a lawyer, because these are the 4 streams which are known there. So if you didn't get into medicine, you thought, that was the end of your aspiration or your passion for serving in the health sciences. Well, now you have an option. Even if you don't get into medicine, you can get into any of the allied health professional programs and still contribute your might. You can be a very important component of the holistic healthcare. Now, globally, if you look at it now, the holistic healthcare is what is now the mantra. As Dr. Ravi Kumar very rightly said, the doctor or the surgeon does his job of a medical or a surgical intervention, but that's not the end of it, because you need to have certain more things to improve the quality of life. So, for example, now I would relate to Dr. Ravi Kumar and me, because I am basically a doctorate holder in speech pathology and audiology. So I'm more connected to the ENT. By virtue of me being the founder dean of an allied health college, have 69 programs, I came to be aware of all other programs. That's why I'm here to give you an overview about allied health programs. Now, as Dr. Ravi Kumar said, a child who is born with a hearing impairment, who is absolutely not heard in it, because there is no hearing, there is no speech, because unless you hear, you will not be able to speak. Now you have a cochlear implantation surgery being done. You do an implant, you put the electrodes inside, that's done by the ENT surgeon, and that job is done. Just with an implantation, the child wouldn't be speaking or hearing. Next comes your rehabilitation program. You need the audiologist to map, to switch on the device, to map it, to find out how much of voltage has to reach each electrode inside the cochlea, the different frequencies from different parts, and then to train them in the speech, to be aware of sounds, to know how to differentiate between the sounds, the discrimination part of it, how to pronounce. So all that forms a very major task. In case if you ask, a good surgeon can do a cochlear implantation in 1.5 to 2 hours. Not a big job for a good surgeon. But subsequently, to make the child to speak, to be mainstreamed, that is the job of the allied health professional. I'm talking about a speech and hearing professional. The same way, if you take up an orthopedic surgeon who operates on somebody, let's say an amputation, or somebody with, has a stroke, or he has a fracture, whatever it is, after the job is done to get back that function, it's the job of the physiotherapist, gait training, the different athletes, like their biomechanics of, their movement, their different muscles, how do they do that? Now, that's why you say now you have every sportsman has his personal physio. Every academy has their own physiotherapists. And again, there you have lots of branching. You have physios in cardiopulmonary, physios in neuro, you have physios in pediatric, you have physios in obstetrics and gynecology, you have in community medicines. Okay, you have a whole range of specialties. The occupational therapy, again, as Dr. Ravi said about not being, it's an unsung hero because many people know about physio, but not occupational therapy. It's a very important, challenging profession. It's in terms of restoring the functions of somebody who has lost a thumb. How do you get a splint? How do you use your hand? What gadgets can you use it? Your assistive, devices of at a home. How does the child, learn to do in a toiletry or do about kitchen, all that. So all functions. So these things are all very, very important, especially if you're looking at the quality of life, and a country which is cultured, a country which is civilized, is rated in terms of what it does for the disabled. So that's basically about that. So right now, what we're talking about allied health professionals, with reference to SRM offering, they have certificate diploma programs. They also have graduate programs. They have master's programs or postgraduate programs. A graduate program, by and large, is a 4-year program, 3 years of coursework, and 1 year of mandate or a compulsory internship. That means right from day one, you will be in a hospital setup, spending 50% of the time on theory classes and 50% on the field. When I say on the field, I'm talking to you about the hospital, the wards, the patients, assessing, evaluating, and then planning the management, or what you call in general as rehab or therapy. So right from one, you are inculcated into the basics of the hospital culture, bedside manners, how do you interact with the patients, the caregivers, how do you as a team work for the best of the patient. Okay, so it's a 4-year program, and 1 year mandated internship is a must because you must spend at least 50% of 6 months of the time in the hospital of your institution, and then you're also posted outside for an exposure in the other areas. And fortunately or unfortunately, unlike the Medical Council of India, the Nursing Council, the Pharmacy Council, the Dental Council of India, which are regulatory bodies which can regulate the opening up of any center or any college in terms of the minimum requirements of faculty, facilities, as Dr. Roy rightly said, you must have a faculty of good caliber, you must have facilities, you must have, the resources, a good library, good classrooms and all that. The allied health professionals do not have a council. Barring 2 or 3 programs, for example, you have the speech and hearing or the audiology and speech pathology is regulated by the Rehab Council of India. It's again a regulatory body under the government of India, Department of Social Justice. MSc Clinical Psychology or the MPhil Clinical Psychology is also governed by the RCA. All other programs are governed by the respective associations. For example, you have the Association of Physiotherapists of India. You have IOTA, the Occupational Therapy Associations. You got optometry, they got a council. So they have their own bodies. So there is not much of a uniformity in the curriculum, uniformity of training, uniformity of of standards. But the good news is that a National Council of Allied Health Sciences has already been proposed. They have been working on this for the last 3 to 4 years with the Public Health Foundation of India under the Ministry of Health and Family Welfare. I was also part of the task team, and that has been tabled in the Parliament now, and it's only a matter of time before it becomes an act. And once that comes into force, then all the institutions offering allied health programs will have to be governed, will have to come under that. There's going to be very strict rules and regulations of do's and don'ts. So what I wanted to caution you about is that when you're choosing these allied health professional courses, which are quite challenging, rewarding, and lots of job prospects, because as per the data which has been collected by the public health, of India, there is a demand supply gap of 60 million. Okay, people, allied health professionals needed in this country. Now, what's happened to those who are being trained in these institutions? Let's say a few of the universities and a few of the colleges, 80% of them go overseas because they get a good package, good recognition, and they have a role to play. But that's coming into the Indian market now. And now I'm sure that with the advent of the new council, there's going to be more job opportunities, more prospects, more stature, and also better prospects of your, for your profession. Okay, so I just wanted to touch upon some of the courses which Dr. Ravi Kumar has already talked about. You're aware of physiotherapy, not much aware of occupational therapy. You're aware of speech and hearing. Then optometry is a program which is again quite a very promising thing, because lots of these people, they are opening up or going overseas or having their own ventures. They can join any of the optical teams. Like for opening up a medical shop, you have to have a pharmacy licensed person. The government is going to introduce even every optical shop must have an optometrist. Now it's just not refraction or testing the vision and giving you glasses, but much more than that. They get into the nuances of contact lenses, they get into low vision aids, they get into rehabilitations, they get into the industry. Okay, they get into lots of things, including research, innovations, and industry. The same way a medical imaging technologies. He's just not a radiographer who does a plain X-ray, but gets into the medical imaging technology. So much of advancement is there. There's a CT scan, you have your PET scan, you have an MRI, ultrasound. So all this become the realm of a medical imaging technologies. And of course, you have your respiratory therapist who takes care of the patients in the ICU, especially breathing. And then you have your cardiac care technologies, you have the dialysis technologies. Now, all this start with a graduation, and then they go on to a post-graduation. Then you have options of getting into a hospital, getting into a nursing home, or doing your freelancing. For example, you have freelancing audiologists, freelancing speech pathologists, you have freelancing physios. Okay, so depending on what is the area of your allied health professions, you have numerous opportunities in India as well as overseas. But be sure that you know or you learn about what you're going to be. You must get into the understanding of what am I going to do or what am I going to be to become an optometrist. What's going to be the training that I get? Now, all these programs, they have a basic course that's called the basic sciences, where everybody learns anatomy, physiology, microbiology, biochemistry, whatever you need for your understanding of your healthcare. And then you have your core subjects where you get the depth of the core subjects. For example, if you take up, say, speech and hearing, now they have courses on voice culture. You have courses on cochlear implants. You have courses on aphasia. Somebody has a stroke and loses the speech. Somebody has an articulation problem. Somebody has stammering, stuttering. Numerous, the communication disorders are there. Now with the geriatric coming in, now old patients, and the number of aged people living is increasing now. The geriatric care is also something which is now picking up. So people with dementia, people with, these age-related problems of falling and getting injured. So all those will come under the realm of the allied health professionals. So you have a vast, You have a vast, arena or a canvas which can be painted upon. Okay, but only make sure that you understand the program that you are going to get into. You make sure that you get into a good college or a university with all the facilities. Now, there are riff-raff colleges offering these programs without a hospital attachment. It's like somebody learning, the theory of flying a plane with a simulator, of course, but then unless you are in the cockpit and you're going to fly it, you're not going to get the experience. So allied health professionals will have to be exposed to patient care, or what we call as the clinical exposure, right from day one, if they have to have the confidence of handling a patient, the confidence of delivery. So make sure that you get into a good institution where the fee structure may be a little higher. Government, it could be cheaper, but not all of us can get into the government setup. So if you choose a profession in allied health sciences, you go into a good university or a good center, make sure that you have all the requisite in terms of infrastructure, in terms of facilities, in terms of, most important, the faculty to teach you on the basic sciences as well as your core subjects, and a hospital attachment, which is vital if you want to really make it up. These are the things I just wanted to tell you about. And one more thing is that, so I was telling you about, globally there are about 139 allied health professional programs globally, of which we have only about 69 to 70 in the Indian context, right? So I'm sure that it will keep on adding up year after year, and there will be jobs coming in once the council comes. There will be, job positions coming up in district hospitals or every hospital, and every department should have, the allied health professionals, and then only you have, you can say, as a multidisciplinary team. So opportunities galore, and I think you can take up any of this profession and then look for a challenging and a rewarding career. I have seen many people, even children of, renowned established doctors, coming and asking for allied health, says, I want to do an occupational therapy, or I want to be a speech pathologist, I want to be a clinical psychologist, I want to be a nuclear medicine technologist. So gone are the days when you say medicine is the only thing in health sciences. Medicine is the key. That's the pivot on which we all revolve about. But all these have an equal footing, all these have an equal weightage. So this is what I just wanted to give you an overview. So the future is very bright for allied health professionals. You wouldn't believe if I told you that 80% of my alumni are all spread across the globe. Only 10% are in India. But we want to reverse it now. Like our Prime Minister says now, make in India, let's retain people in India, which I'm sure the government of India and the state governments are really definitely working towards giving you a better job, better opportunities, better recognition. So you can confidently take up allied health professionals. I wish you all the best in your endeavor to be future allied health professionals of caliber, quality, and standing. And we are open to you for any questions and answers that you wish to ask us regarding any program. We'll be happy to share. Thank you.
Thank you, Dr. Rajshekhar. That was really interesting. Quite a lot of things that even I did not know about allied health sciences. There are some questions here. One person has asked, is there a scope for BSc Agriculture? So,
That's not my cup of tea. I think the Provost Chancellor, I think.
yes. Dr. Ravi Kumar, could you answer this question?
Yeah. I mean, I'm not sure if they're asking if that's an allied health sciences course.
Yeah.
It's not, but we have an agriculture college in our university where there's a program for BSc Agriculture also. That's a different field. It doesn't come under allied health sciences, if that's what they asked.
Yeah, I thought she was probably asking after BSc Agriculture, can she get into allied health science course? I'm not sure.
She can start off from beginning, because she can't just get a lateral entry.
Okay.
In case you want, she'll have to start again from the UG program.
Okay.
Because see, you have a lateral entry if somebody has done a diploma or a certificate.
Ah.
Have provisions in any university for a lateral entry into the mainstream. Okay. But from agriculture to shifting to allied health will be a different ball game. It's two different things, you know. So they'll
You
have to
need
start.
biology.
Yes.
Yes. You need biology. Yes. Without biology, you can't get into the
Yes.
subject. So there was this basic question, what is UG and PG, which I just answered when we were talking about it. And a lot of people have asked for the PPT, PowerPoint presentation, I think, Dr.
Yeah, I
George.
have promised to send them if they give me the email ID.
Okay, so I think many of them have actually sent their email IDs also.
Okay, I'm sorry I didn't make a PPT because I be a speech and hearing personnel. I believe more in speech, and then I focused on that. But if they want, I can send a PPT which can cover the all the gamuts of whatever I talked about.
But one advice I am suggesting to everybody, the PPT was made in my case on the list of courses. It's available on the website of SRM. All the courses available, and also there is a helpline. There is a contact person who can advise them more about it. We have admission counselors, and there's a whole lot of admission team members who are available for any questions. So please go to the website of SRM IST.
Just to add to what the Pro Vice Chancellor was saying, I think if you get into the website, every course has a description, a course description. So it tells you what exactly is the course about, what are the students being trained in that. So that gives you some kind of information. And if they need more, I think they can contact, as the Pro VC was saying about the counselors who will provide them with more information.
Okay. So here is somebody called Rohit Rumale. He says, I would like to ask if there is any upward mobility in terms of qualification for 2-year A&M course. Completed nurse. Dr.
Yeah.
George.
Yeah, upward mobility in the sense, A&M is an auxiliary nurse midwifery course. They cannot directly go for any course. They have to start with BSc nursing. There's no lateral entry for A&M, only for GNM. Those people who completed diploma in general nursing and they have a 2-year course, special BSc. The A&M, they have to join BSc and study 4-year course.
This is across the country. It's the same.
Yeah, it is across the country.
Then somebody's asked, do you provide consultancy? I have no idea. I don't know for whom this is.
Are they asking about consultancy to choose a course?
I think so. I'm guessing. I have no idea.
Both these deemed universities are counselors. Admission counselors are there. They will.
So then
Happy to help.
How good are institutes which give training and certificates in tie-up with NSDC or Skill India, and how are they different? I think.
Okay. I can answer.
Right. Yeah. Please. Yeah. Just Dr. Raj, go ahead. I will join.
Yeah, because NSDC is not offering any degree course or things like this. Just skill development centers with short-term courses like 3 months in general duty assistance for in the hospitals, or ECG technician, or just small skill job-oriented courses. People who are from the entrepreneurial section who have just passed SLC to have a small job. That's the planning programs of NSDC. They are not degree courses like which are run by the SRM University or Manipal University or other government universities. But small skill development program. These programs are generating jobs because they are highly needed in especially in the healthcare sector. General duty assistants and also ward boys, ward girls, ECG technicians are such small specific skill for a short-term course. Maximum duration of their course is emergency technician course of 6 months. That is, newer scheme under the current government. They have, especially with the rural young people to generate jobs, this course started. This is not comparable to those courses which are discussed here. That's what.
Yeah, I think as what Dr. Roy was saying about, it's for somebody to get a job in a vocation. So it's like the to increase the manpower, right? It's basically at the grassroots level, right? They'll just be doing the work, at different centers. But if you're looking for a career, I think you must start with a graduation and then go on to a master's or a post graduation. And then, of course, you can go into a doctorate, research, whatever faculty, all industry, everything. So that is something different. Skill is just to put everybody onto the, job list. Somebody has a skill, somebody gets a job. That's it.
If I can add one more point to that, most of these graduate programs and diploma programs are all regulated by a council, statutory council. So they have a good curriculum, syllabus, and a structured way of teaching and evaluation. Evaluation meaning exam system. So the value of these programs is much higher than just learning the skill. You get a certification which will stand you in good stead, not only in this country, maybe in many foreign countries, especially Middle East, where a lot of our skilled manpower is moving off. So if you want a proper system of training, certification, and skill training, then a graduate degree or a diploma is better than just taking a skill under the skill program.
So here's one person who's asked, what is the most challenging job and have many demands?
See, that's only because everything, there's nothing inferior or superior in a profession, allied profession. It all depends upon your passion, your aptitude, and how much you can reach in that. So whichever you take, because it keeps changing. Like, if you take up technology engineering, as of 3-4 years, you find that people are there's a big beeline for programs of computers. And somebody, there's another 2 years where you go only for mechatronics, and then they go for aviation. So it keeps changing. The specialities or the ones which are in demand keep changing, right? But if you're looking for something, if you are really passionate and if you are committed, sincere, and join a good institution and get the training, everything is challenging. Everything is equal at the job market.
Okay, here is one
Simple
question.
term, challenging is what you make of it.
So here is, I think this must be probably for Dr. Ravi Kumar, quality assurance and audit officers. How can this be related to hospital facility? How is this one related to hospital facility?
Yeah, actually, it's one of my favorite topics, quality assurance, because if you classify a professional organization, which a hospital or a medical college or a allied health science college should be, then we need to have a certain set of standards and quality parameters. So quality assurance is a process by which you achieve that and maintain it also. And for this purpose, we have in many educational institutions, including medical institutions and hospitals, a quality assurance team, a quality assurance cell. And these are the ones which are responsible for not only introducing quality in education, healthcare systems, patient care, safety, the various aspects which form a safe environment for the patient or the person who is visiting that facility or studying in that particular institution, and maintain that, monitor it, and then also measure it against the best in the world. So if this is to be done, you don't need just a doctor, you need a team. And these allied health sciences personnel who are trained in healthcare can be part of the team. In fact, some of the areas, they actually lead the quality process also. So the question is the requirement? Yes. Is allied health science personnel also part of that quality assurance process in the institution? Yes, they can be. It all depends on their aptitude, their interest, and the recognition they get for that, and how they're able to integrate with the team in the quality assurance process in any institution.
So one person.
Can I just add to what Dr. Ravi Kumar was saying about? I think that question was, it really opened up the interest of something which I didn't touch upon. It's a program which is being offered out of SRM, right? It's called the medical records. Not very well understood by many people, because people think medical records is the old records, an outpatient file, inpatient file, and what do you have to do a degree program with that? That's what people asked us when we started the program in Manipal. But it's no longer only medical records. It's called now health information management. Now, all the major hospitals, they have so much of data, medical data. They have to be, coded. They have to be billed. You have insurance, and all these people who do this health information management, which is beyond just medical records. They're all in good managerial positions in the hospital. If you go to any big corporate hospital, you have a manager. He has done a graduation or a post graduation in health information. You also have a health informatics also is there. So many people think a medical record is just going to be some kind of a clerical position, and what's a degree going to be? This is something which SRM is offering. I think people can look at that. It's called medical records. For this, I don't think you need a science background. Even from arts and commerce can get in because they have one subject of medical terminology where they're taught about the different medical terminologies, the basic, the terms that they have to understand. Okay, so that is something which is unfathomed, or I would say unexplored area. And if you go to Gulf overseas, many of our graduates are all in the hospitals as managerial positions, midland managers, drawing a good salary package. Health information management or medical records as being offered at SRM.
Here is one question. How are the admissions being done? Through NEET or individual institute entrance exams?
The Pro-Vice Chancellor will address this question.
Okay. Now, we have our own entrance mechanism. NEET is only for the MBBS, MDMS, and BDS, MDS. So apart from that, all the other courses, there is pharmacy, nursing, etc. Each university is empowered to conduct an examination or have their own selection process. We don't have any reservations, etc. We have an open system in SRM. And recently, this year, because of the pandemic, we have introduced e-counseling also. And the selection is done remotely. We don't even ask the person to come to the university for the selection process, but it is a provisional selection based on the marks and based on the qualifications as well as on the grades. We give them a provisional admission, and then when the results come out or when they are able to produce the original certificates, etc., then we'll be able to confirm the selection. So it's pretty much open, and it depends on your merit list. And this has been left to our university to decide about it. And regulation is only in terms of the minimum type of qualification. For example, I told you about biology being one of the subjects which must be there for allied health science course. We cannot take somebody with chemistry, maths, and computer science into allied health science. The biology is a must. And similarly, the merit list has to be minimum marks should be 55, 60% like that. And then we draw up a list, and then depending on the merit list, we offer them the courses. They have a choice. E-counseling is taken off very well in SRM, and it's on even now. It's almost 50 to 60% of the selection has been done in the medical health sciences group with e-counseling.
Okay,
again, I refer you back to the website where all the details are there. Plus, there are certain individuals who have been earmarked for this counseling. Over to Raj.
Okay, sir, I just wanted to, touch upon one more, which I think people should be aware, and what's being offered in SRM is that accident and emergency care. That program is there. So it's something again which is very challenging because with the number of road traffic accidents and emergency trauma and then all that happening, these people will be involved in the initial diagnosis and management of acute as well as urgent aspects of any disease or injury. So that's the first thing, like when a patient is brought into the hospital, they go on to the emergency or the accident. That's one program again which is something new. The last few years it really picked up. That's one thing I think people can look at it. You also have one program called the OT or anesthesiology technology, where they would be working with the anesthetist in helping them with the operative procedures. Okay, that's again, I think, something which is quite challenging and quite job oriented also. They work in ICUs, they work in trauma centers. Perfusion is one thing which again Dr. Ravi Kumar was talking about, cardiac care surgery. You have to have a perfusion technologies because he is the one who, because the heart is being operated and there's a heart lung machine which replaces the heart during the procedure of the surgery. And the person who manages that, monitors that, handles that is the perfusion technologies. So it's again something which is in great demand. The paucity of people in the country and overseas, great demand again. They can look it up. The rest of the things, I think, people do have an idea about it. But if anybody wants more information, they can always log into the university website and get more information.
Here is one question. Are MSc nursing and further research courses mandatory, regular, or can this be done by correspondence too? Dr. George.
Online correspondence.
Nursing, no.
Not that we have only full-time regular courses in PG, because this is something which we have to practice and have the experience with the patients and hospital. Maybe in a later time we may have mixer courses like part online and rest on the physical training. That let me take another 5 years to develop. We may have, but right now we don't have. Whatever is done as distance mode is fraudulent courses, not recognized course. All recognized courses has to be full-time regular courses as of now in India.
I have input on this. Because of this present pandemic situation where we are restrained by accommodation for so many students, where we have to physically separate them and make classrooms less populated. And also because many parents are not very keen to send their students to the college for fear of catching the virus. We have thought of something called blended learning, where we would be taking most of the theory lectures online. But when it comes to practical teaching and learning, it has to be in the campus, either in the laboratory or in the hospital. There again, in order to achieve a certain amount of social distancing, we have decided to use our skills lab and simulation lab and demonstrate certain practical experiments or clinical demonstrations, in addition to making the student learn on the patient also, but that will be a limited number. So we will be rotating them in smaller batches so that they maintain the distance. At the same time, they don't lose out on the learning. So if you separate the theory lectures on an online mode, there is more time for devoting into these practical learning on site. So it will be a blend of both. This is what we are planning, and I hope we come up with a solution. Because as long as the pandemic is there, we cannot let the campus get crowded with more students. We have to restrict the numbers.
So I think there's one more question. There are plenty of questions. I think we've just dealt with 1/3 of the questions that have come in. So I don't think we don't even have much time there. There's one question. Does the institute giving speech language, does it have Rehabilitation Council of India recognition? I think.
Definitely.
Yeah, definitely.
Definitely. Without that, you can't start the course.
Okay. So some people have had some very personal questions. My daughter has got so much percentage. So what are her chances?
Admission counselor.
Then, so there are quite a few questions. So I'm just wondering.
Any commonality?
They have asked for bee farm. We have not touched on bee farm. So,
They must have told, no?
I did touch about bee farm. Bee farm is a good course, and because you get a chance to branch off either into the pharmaceutical industry or do a research work or get into drug development or be your own pharmacy owner or you could be a pharmacist in a big chain. There are so many job opportunities. It's a good course.
Here is one question. I had finished my master's in dentofacial radiology. Am I eligible to pursue any diploma in radio technology?
You have to see the degree she's holding already, because if it fits into the requirement according to the curriculum and etc. of the particular course, we can consider it. I need more details.
Does BSc Physician Assistant have a good scope?
Yes, it has in the modern day medicine, because these are the people who work in ICU settings and the so-called step-down ICU settings, where they are in between the nursing and the physician himself. They are empowered to give certain medication orders, empowered to carry out certain investigations. They are in between the nurse and the physician, and they are accompanying the physician during the rounds. They are taking part in the management of the patient, but they cannot perform surgical procedures. They cannot prescribe certain medication. Those are the limitations. But it's a good course which has got a lot of scope, because there is a shortage of doctors. There's a shortage of nursing has got much more role to play. They don't have time for these things. So they are the in-betweens. So there is a good scope.
So there's a question for Dr. George. Please tell me when BSc Nursing counseling starts.
It's a very difficult question in the time of COVID. Like, otherwise it would have been over now by now in many of the states. Now it's all delayed. Many universities are doing it online, like as Dr. Umar already told. Some state governments in many places are yet to make the final list and go for counseling because of the COVID. So it will take time. I do not know which state the questioner asked. Maybe Tamil Nadu.
Yeah, it's not sure which state.
But it will always be after NEET.
I think after NEET only it will come.
So here's one thing. I had finished my master's in dental radiology. Am I eligible for a diploma in radio technology in CT scan, MRI scan, PET scan?
I mean, should be possible to consider. It depends on the subjects she has done in the previous degree. I mean, anybody, I mean, this particular specialty she's referring to actually is for people who are done and come in for a BSc course or a diploma course. So she should be eligible.
Okay. My family wants me to work abroad. Will SRM recommend us for jobs abroad after our allied health medical courses?
It depends on the specialty and the demand from the foreign country. I mean, there is no such rule that only a certain person will be sent abroad. We are not selecting for abroad. We are definitely having tie-ups with many foreign universities. And if there is an opportunity in that particular field, we'll definitely assist her in getting the placement.
I have completed BSc microbiology. Is there any chance to enter in medical field? What course should I select? BSc
Medical
microbiology.
field.
Yeah.
BSc will
broad.
go microbiology only, MSc microbiology, virology. Now that the virology has taken on a big role, so we could consider those courses where we have master's degree in the same specialty. But if he is meaning MBBS, no. A microbiology background will give them, the ladder will be MSc, PhD, things like that.
What does a person with PhD in nursing do?
Teach and guide.
Yeah, generally it is teaching, but many people are into research and administration. They take up research project, independent projects, and also guides other students in research for PhD as well as MSc.
Dr. George must be himself a PhD. Our Dean of Nursing.
Yes. May I know the scope for occupational therapy?
Excellent. Excellent, I would say. Okay, because there are not many colleges in the country offering. There are only very few. I think SRM is one of the I would say top, because they have a master's and their bachelor's and master's program. The number of the occupational therapists graduating as compared to the other programs are less. So more demand, less supply. So it's good, and especially overseas, I think there's a huge scope for occupational therapy.
Just to add to what Rajshekhar said, we started the occupational therapy course for the first university to start it more than 15 years ago. And the first PhD in occupational therapy is the current Dean of Occupational Therapy College in our institution. He was trained here. And already our counseling which has taken place, we almost filled all the seats in occupational therapy. That is the demand in occupational therapy. So it's a very good course and it's got good scope, provided you have that inclination and focus in that particular field. You are dealing with people who are not so very able. So you have to have that attitude to get them back to do a job.
Okay. So now I think we are going to close it here. Most of them have asked the same kinds of questions. Maybe we could just forward certain questions if they are very specific to you. We are running short of time. I thank each one of the panelists for taking their time to be with us. It has been very, very interesting, very invigorating. I enjoyed the session a lot. Thank you very much, all of you.
It's because
Thanks
what you are. Thank you. Thank you.
I personally wish to thank SRM and especially the Pro Vice Chancellor Ravi Kumar for bringing me on board. Okay, though I am from a different university, he wanted me to to highlight about allied health sciences in view of me being the founder dean and the longest serving dean. And I thought that sharing of knowledge is it always gives you a lot of pleasure. So thank you, sir, for taking me on board. And I wish to thank Hindu. Hindu has always been a favorite paper right from my father's days. So thank you very much.
We are honored to have you here, and especially special thanks to Sujata, who's been associated with the health affairs. She's been the editor for health for a long time. And the whole webinar was conducted so beautifully by the Hindu. The whole team deserves our kudos and congratulations. And I hope the students, especially aspiring students and the parents, have benefited. We are available for any further clarifications also. Thank you all and wish you the very best.
Thank you. And
thank you.
Special thanks to Mr. Shanmugam and co, for the technical, the help and the program to go on without a hitch. The Shanmugam, Mr. Nanda Kumar, and the whole team. Thank you.
SRM Institute of Science and Technology, Engineering, Medical and Health Sciences, Management, Dental, Science and Humanities, Law, Agriculture Sciences, Hotel Management. Admissions open.